Hello, hello. Is that coming through, Anna? No, still nothing.
It's okay, there's a time lag on it.
Oh, there is. Okay, thanks. Welcome, everyone. I'm Councillor Matthew Winnington, Cabinet Member for Community Wellbeing, Health and Care, and co-chair of the Health and Wellbeing Board. Limited public speaking is made available. However, this meeting is also being webcast to allow the public to attend remotely if they so wish. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble in Guildhall Square by Queen Victoria statue. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who's signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that this meeting will be live streamed. Everyone speaking via a microphone will be on camera, include those making deputations. Members of the press and public are also permitted to record the meeting in the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphones? You can bend them towards you as such, and please remember to turn them off when you finish speaking. We have read the reports, and presenters please only highlight any developments that have occurred since publication. Finally, I'd like to welcome Councillor Nick Dorrington, new Cabinet Member for Children's Families Education. On behalf of the board, I'd like to thank Councillor Susie Horton for her contribution over the years, and I'm very sincere on that. Susie has been a great contributor to this board. She has always said as a Cabinet Member it was her favourite meeting, and she finds the work of the board extremely thorough, interesting and interested. So I'd like to just put on board my thanks to Susie on behalf of myself and Linda as co-chairs of the board, just for all her contributions and the thanks we have as a board overall. So if we then make introductions and we start to my right.
Anna Martin, Democratic Services.
Helen Atkinson, Director of Public Health.
I'm Kelly Nash, Strategy Unit at the City Council.
Linda Colley, GP. I'm Clinical Director for Portsmouth Place for NHS Hampshire and Isle of Wight and co-chair this board.
Councillor Graham Heaney, Deputy Leader of the Labour Group.
Kirsty Branford, City of Portsmouth College, one of the Assistant Principals and Deputy Designated Safeguarding Lead.
Sarah Daly, Director of Children, Families and Education.
Lucy Ryler, Portsmouth Safeguarding Children Partnership Manager.
Fran White, Associate Director of Policy, Innovation and Partnerships at NHS Hampshire and Isle of Wight.
David Goosey, I'm Chair of the Safeguarding Adult Board.
Graham Terry, Director of Strategy at Portsmouth Hospitals.
Bernie Allen, Partnerships Director for Portsmouth from NHS Hampshire and Isle of Wight.
Hi, I'm Heather Mitchell. I'm the Director of Population Health Equity with Hampshire and the Isle of Wight Healthcare.
I'm Gemma Nichols, Chief Exec of Portsmouth Creates.
Lorna Reevely, Chief Officer of the Hive Portsmouth.
Jason Oakley, I'm the University of Portsmouth representative.
Hi, Roger Banterbury, Chairperson, Healthwatch Portsmouth.
Good morning, Diane Sherlock, CEO of Age UK Portsmouth.
Councillor Roman Dent, Portsmouth Independent Party.
Good morning everybody, Councillor Dorrington, Cabinet Member for Children, Families and Education.
Good morning, Phil Foxton, Hampshire and Isle of Wight Fire and Rescue Service.
And Caroline Hopper, Corporate Projects Manager, Portsmouth City Council.
Hi, good morning. David Joyce, Adult Social Care, Head of Safeguarding, Mental Health and Learning Disability.
We just had a late joiner. Could you just introduce yourself, please?
Good morning. Apologies for lateness. Bad traffic. Frances Solb, Chair of Portsmouth Education Partnership.
Thank you very much. Great to have everyone here. We do have a deputation request from Councillor Lee Hunt. So on the who's the cabinet member for including community safety. So he is unsurprisingly going to be wanting to speak on community safety today. So he's really keen to do that. So on to our agenda then. So we've got apologies for absence. Can we just have apologies for absence, please, Anna?
Councillor Steve Pitt, Leader, Portsmouth City Council. Andy Biddle, Adult Social Care. Natalie Brahma Pearl, Portsmouth City Council. Penny Emmerett, PHUT, but she's represented by Graham Terry. Michelle Ennis from the Hampshire and Isle of Wight Integrated Care Board. James Hill, Housing, Portsmouth City Council. Superintendent Paul Markham, Hampshire Police. And Joanne Shankton, City of Portsmouth College, but she's represented by Kirsty Ranford.
Thank you very much. And I should have said, and as we've got Councillor Hunt here to do his deputation, and Caroline as well, who's going to be involved with that, we're going to move the community safety item to after item 3, so it will be on new item 4. Colleagues, any declarations of interest? Oh, yeah.
I mean, I know I'm not an official member of the board, but if I'm representing Hampshire and Isle of Wight Healthcare, I am a trustee of Energise Me, who operate across Hampshire and the Isle of Wight.
Thank you very much. Appreciate that. That's great. We called that one. So item 3, minutes of the previous meeting, 20th November 2024. I won't go through them. Again, presume everyone's read them. Is everyone happy with those as a correct record? Yeah, okay, brilliant. So if we move then on to the previous item 7, community safety update. So over to you, Caroline.
Thank you. Paul Markham was due to deliver this update, but is unable to be here today as the chair of the community safety focused meetings of the Health and Wellbeing Board. So you have all had the paper, and I'm aware that Councillor Hunt would also like to add to this, so I'll keep it brief. So the key points are that the group is up and running, which is fantastic. So it's been established and it's got good levels of engagement from all responsible authorities, which is really positive, and others. We're working on our forward action plan following the prioritisation exercise that's detailed in the paper, so that we can make sure that we have a comprehensive plan to meet the 4 new priorities that we have for the next 3 years. We've been specific around having a 3-year plan to ensure that we have something that takes us into what we would expect to be a new landscape in terms of particularly local government, so that we're bridged for that. We're also there positioned within this group to respond to emerging items. So whilst we'll be looking at our monitoring plans, etc., as a kind of general rhythm of our work, we've got things that we're doing currently, like looking at responding to the statement of licensing policy. This was something that has historically always been supported by the Safer Portsmouth Partnership, so it's an opportunity for this group to get involved in that. We're also looking at about how we can take learning from other activities within the Health and Wellbeing Board. So, for example, the homelessness intervention that James provided an update about last week with people with complex needs. We have a priority around how we're supporting people with complex needs in a community safety context. So we're looking at what we can do to take that learning. And then from a local government perspective, I have put this model forward as a possible case study to the LGA, showing how we're making sure that we integrate with wider priorities around health and wellbeing in order to be able to address those causes of the causes alongside community safety. I know that what Councillor Hunt is keen to do is to go into a bit more detail about what that might look like at a practical level in some of the services that are encompassed within community safety and some of the sort of a bit of a teaser for some items that I know that he's keen to bring to the Health and Wellbeing Board in the future about how we're looking to address some of the issues in the city. So if there's no questions for me, I'll pass over.
All right, good morning, everybody. I have a fair amount to say, so I hope you will bear with me, and I won't drag it out. But I think what is important to say around community safety is that what's important to the Portsmouth City Council and to me is working in partnership, including, of course, with all of you on the safeguarding of all communities across the city. And personally, what drives me as a cabinet member and in this role and several roles is to give more young people more things to do. So soon we've asked BH Live and the Andrew Simpson Centre, which is formerly the Outdoor Centre up on Euston Road, to come here and give you, and Matt's agreed, to give you presentations on what they do, so you can see the coalface around inclusion, enormous amount of inclusion, and especially around special educational needs, very important in achieving the goals that you set us all. So the report today, which describes a space or a forum for a specific community safety focus group for partners, described in the report, not least the fire service, who probably know just as much about where all the drugs are stashed around the city, because they do all the examination of the buildings and so on, and they come across these drug stashes, and residents impart a lot of information to fire officers, which I'm sure gets passed on. So this forum is to sit down and explore more deeply community safety issues to better inform the strategies and planning and priorities that drive your work here at the Health and Wellbeing Board. This space has indeed been missing since 2019, when there were the mergers of the various boards, and I think, and I am sure you will agree, it will strengthen the jigsaw of health and well-being of citizens across Portsmouth. So I'm grateful to Mr. Markham, who unfortunately can't be here today, for agreeing to write this report, setting out how this space works and where it sits within your framework, which is described in the schematic which Caroline has produced. I'm sure we can all agree that deeper conversations in this forum or this space will help Caroline and others improve still further on the good work of the Health and Wellbeing Board, driving down antisocial behaviour, which I am informed by the OPCC is going down, and crime, and preventing and detecting domestic abuse to better safeguard women and girls and work with perpetrators to stop domestic abuse. Everything that we do across the portfolio of community safety services at Portsmouth City Council seeks to address the priorities agreed. So what do we have at our disposal to help us with that? Well, for a start, we have Caroline, which is very helpful indeed. But importantly, we have partnership. It's key to everything that we all do. Partnership with you, with the OPCC, police, charities, businesses and volunteers, and our staff who deliver all the things that we do. So I'd just like to touch on some of the services, especially as much of what we do is indeed non-statutory. And we're able to do these things because this City Council is in good shape financially. Compared to many other places, we do a whole lot more. The City Wardens Service, for example, they are very active, helping us to deliver on our priorities and your priorities. You may be aware that this frontline service is instrumental in helping us heal the status of homelessness. The wardens regularly make contact with individuals sleeping rough and help to get them on our pathway into safe and managed accommodation and supported thereafter. A good example was a man who, after divorce, ended up on the streets of Portsmouth. And he was in a downward cycle of drugs and alcohol. PCC Outreach intervened, housing him in a flat, and this man has now gone on to recover his life, amongst hundreds of similar other cases. And he now commutes to London daily with a £50,000 salary. Of course, all the rail fares have gone up. Anyway, and we have hundreds and hundreds of individuals like that on this multi-million pound pathway, which is pretty unique to this city than anywhere else. So I also have oversight. I'm just giving you a flavour of some of the things that we do. And I also have oversight for housing and multiple occupancy licensing enforcement. And we use all powers available to tackle rogue landlords who exploit people and cram them into shared accommodation. And we will use every means available to us to crack down on rogue landlords behaving in these criminal ways. And this, of course, impacts GP services and housing services, driving up the standards of accommodation for people so they live better and more happy lives. You may have seen one such case recently where the Crown Court handed out a sentence of community safety order for 200 hours and fines of £50,000 to the director of a company and his agents. And there are many other more cases like this, and over the years the City Council has forced up the standards of living and will continue to pursue these rogue landlords. Around regulatory services, we crack down on rogue traders, again resulting in prosecutions, and recently in the Crown Court a man has been sentenced and will soon be sentenced rather for conning residents out of tens of thousands of pounds. And of course the City Council has to bear the cost of that prosecution. As I say, it's because we're in a good financial position that we're able to do these things. But of course we do them in partnership with the police and regional and national enforcement agencies. And so successful is Portsmouth that the service here, I won't be much longer, Chair, the service here processes suspicious activity reports. That may sound rather benign, but it's very important for the government securing a £300,000 contract to do so. And it is widely accepted that SAR intelligence is key for financial investigations in identifying opportunities to disrupt economic crime and seize illicit assets. And this sharing of information sees law enforcement manifesting itself in tackling modern-day slavery, the selling of harmful goods including illicit tobacco, vapes and trades that harms the health and well-being of people that we all care to look after, and thereby addressing all of the priorities around safeguarding. Through the good offices of Caroline and other Portsmouth officers, the Safer Streets initiatives serves other local authorities across Hampshire, especially focusing on, for example, improved lighting of streets. And of course, this helps us with another non-statutory service, which is our safeguarding CCTV network, which should not be underestimated in how it supports the health and well-being of people across Portsmouth. We have had 51,000 inquiries to utilise footage since it started by the police and other relevant authorities. And all the time the council is expanding that network, and especially by redeployable cameras when other places are getting rid of their systems due to financial problems. And we're improving the quality of footage to help the police and partners in their prevention and detection work. So all of the things I've mentioned help support, for example, the priorities tackling drug-related harm, supporting working together, violent crime including knife crime, and stopping domestic abuse and protecting women and girls. But we don't do this alone. We do this in partnership, which is why we do it well. There is no other way. I hope that I have imparted to you at least a flavour of what we do and why it's important to have that space where all these things can be talked about, and as I say, better informed plans and strategies to benefit all of us. Thank you very much indeed.
Thank you very much, Lee, and really appreciate the time you gave to us today to talk so passionately about the community safety report and also about the way that's giving us a bit more of a flavour about how it does impact on every impact that we have. So appreciate that, Lee.
All right, very good. Can I go?
You can. Thank you very much, Lee.
All right, thank you for that. I've got a lot to do today.
Are there any questions or comments?
I have to take any questions if anybody wanted to ask me a question.
Oh, there we go.
I don't think they dare.
Graham, there you go.
Graham, Graham.
I always dare to ask a question. I was looking at the report and how it explains how the representation, sorry, I've got a bit of a cold, my voice is a bit croaky, to link it to the Crime and Disorder Act and the bodies that are on. What I wasn't quite clear about is who is not on that and how they link into this. I mean, obviously with City Council, I mean, there are so many things the City Council does. They've got housing, they've got schools, they've got the regulatory services, they're really directly connected into this. But I was going to ask a question about the university, which is a community that has young people, etc., you know, and where they fit in with this. Now, I know we have a representative from the university here, but I'm not quite sure I quite understand where we would fit into that. And I'm asking that question as a general question, not a specific one.
Well, I mean, Caroline answered specifically. I'll go generally. I mean, if anything comes up and it evolves, everything evolves, doesn't it? You know, sometimes things get sucked in that we don't want sucked in, for example, but things evolve. And if that is a need, Caroline may well already have it in hand. I don't know. But you say the university actually sits on the board. But having those, I mean, for example, you're right to bring it up because, you know, recently at the text committee when I was attending, where's the university rep? I beg your pardon. Yes. So we were looking at street cleanliness and tidiness and so on, and the university, bless them, told them how they were able to that they did tell their students how to recycle, and we were asked. And so it's a good point. They were asked, how did they tell the students how they recycled? And they said, well, we do it through Facebook. And the Students' Union rep there said, actually, students aren't on Facebook. They don't do Facebook. So we discovered by those informal inquiries that there was a missing gap, which will presumably be addressed now, particularly, by the university and when the report comes from the text committee. So discussion really does help, and if there's a need, evolving need, I'm sure Caroline will tell me and we will get involved.
Just to reassure you that Portsmouth University is already involved in a number of layers of that schematic, from operational targeted group work into some of the tactical planning and strategy work. They're not currently represented in the community safety focused meetings, and actually that is something that we could look to address, because I think you're right in terms of a number of the key priorities and that kind of synergy between their work and ours. We could absolutely look to do that.
But it's not a decision-making place at all. It's where informal discussion and so on gets together, and everybody has a lovely time and a cup of tea and a cake and then goes home.
It's a bit harder than that, but just to manage expectations. But yeah, it is, you know, as Councillor Hunt said, you know, the Health and Wellbeing Board is the responsible body in terms of those community safety functions. This is a space to do some of that doing work so that we can then bring that back to this forum. So.
Yes.
Similar question, really. I didn't see Hampshire and Isle of Wight Healthcare in your list of members. Have you got representatives within some of the working groups there?
So healthcare, again, will be represented across different working groups. So I already know particularly places like the violence against women and girls, we have them in that strategic landscape there.
I'm thinking from the provider perspective, the community and mental health provider perspective.
So if we need to review it, then we can have a look at reviewing that one. We have health in there, but if you feel that we need to have them in a different place, then get in touch and we can have a look.
It'd be good to understand a little bit more. Yeah, thank you.
Yeah, it's more of a comment, really. Councillor Hunt mentioned the domestic abuse to women and young girls, but also domestic abuse does apply to men as well. Just to clarify that.
Yeah, indeed it does. But the vast majority of murders that occur within the home is men killing women. So we very much understand that. And so, you know, where there are resources available, and indeed I make this case within the Cabinet and within the discussions with Caroline. So we are aware, of course, that men can be harmed in this way, and Caroline's going to touch on this in a minute. But the thrust just definitely needs to be about, it doesn't mean to say we disregard men at all, but the thrust definitely needs to be around safeguarding and protecting women and girls especially, but not exclusively, Councillor Dent.
Yeah, that's fine. It's just the fact that in your statement you mentioned women and girls, but you didn't mention the fact that men as well.
And you've very kindly done that for us. Thank you.
And just to confirm that that point about addressing harm for everybody is articulated within the Portsmouth Violence Against Women and Girls strategy that the board approved last November, and that we are hoping the sort of shiny version may well publish this week to align with International Women's Day, but absolutely to reassure any victim of those behaviours that our services are open to all and that we work to make sure that we manage any intersectionality.
Any other questions or comments? Nick?
I think it's worth just noting on the same subject that it's not just the victims of domestic violence that you're working with, you're also working with the perpetrators too. And that's incredibly important, because if perpetrators aren't engaged with, they will go on to offend again and again and again and create more victims.
Yeah, indeed. And this has been a thing for me when we pushed that up the agenda, the council dealing with perpetrators. It has not always been something that everybody wants. They feel that, you know, we shouldn't. There is the victim and there is the person who did the crime. I've come from a background where my dad, very, like so many of us, I'm not the only one, but my dad really beat my mum up regularly. And it was very violent. He was an army boxing champion, you know, and it was pretty horrendous on a weekend to see the drink and everything coming together and seeing my mum beaten up very badly, and having the police come to our house all the time, and the shock and the horror for the children of seeing mum go up the road with her suitcase, swearing never to come back. And as I got older, I said to her, "Come on, let's go," you know, and I tried to get her away. As it happened, she decided to stick out her life with my dad, and I think she just loved him. But he abused that love and that attention, and if this kind of the kind of facilities and resources were around in those days, perhaps my mum's life would have been safeguarded or improved more. So yeah, we all know through our professional work and through our own lives how terrible a situation this can be, and by working with perpetrators, whether the perpetrator be a woman or a man, because there are gay relationships too that come into this, and all sorts of relationships, and we don't discriminate at our council. We've just adopted a policy around definition of relationships. So we will always work with everyone to try and reduce harm, but of course the harm, you see it in the daily newspapers there. I think I saw a report yesterday that said 6% of women killed in the home or murdered are murdered by their sons. That was in a report in the newspaper yesterday, a reasonably accurate one.
Thank you. Any other comments or questions? Thank you very much both to Caroline and to Lee. Really appreciate the time you've taken to.
Thank you for giving me the time.
Come today and to take questions as well, Lee. This is obviously a core part of our work on the Health and Wellbeing Board, and I know that, as say Lee said, talked to me about bringing some other bits and pieces that they're really keen for us all to have that sharing on. So really look forward to those coming in the future. So thank you very much.
Thank you very much. Thank you.
Thank you, Caroline. So we're now moving on to, there was an additional item which was matters arising from the minutes of the last meeting, which was around minute 38, which was the Portsmouth Safeguarding Adult Board's annual reports. And Dave Joyce is going to take us through that.
Thank you, Mark. Yeah, I mean, I think the report that was looked at was covering 4 visits that the engagement group had carried out in the community, and Andy asked me to turn that into a presentation, which hopefully some of you are looking at, and I shall run through it now. So the PSAB engagement subgroup were asked to look at how we can reach the community, how we can engage the community as the Care Act asks us to do, so that the community can have an understanding and awareness of adult safeguarding, what it looks like, where the support is, and so on. So that's what we've done. Now, in order to do that, we've got a really good subgroup. The people in it are really engaged, enthusiastic, creative. So we came up with some props. We got these lovely pens, which we take with us and give to people, which they're really clever. They've got the types of abuse, what might cause concern, how to report a concern, and what will happen. Had I been smarter, I'd have brought you a pen. But thankfully I found one in my bag. If there's a break, I'll go and get you a pen. We've got boxes of them. And that'll be a little memento of the day. So, and we developed a quiz. We developed over time. We didn't just sit in one meeting and say, oh, let's do this. It developed over time. So we went to, so the first group was a Paulsgrove, I think, and we never had much then. And so we developed our props over time. We've got a quiz. We got cards with an app that scans you straight through to the PSAB website. We get ribbons. I know there's a ribbon for everything these days, isn't there? But we decided to go with the colours of the board, which is orange and green. So we hand them out as well. And we're just going to keep developing that, funding allowing, of course. But as I say, the most important aspect is the people, the group of people that we're going out and the people that we're meeting, because that's what community is, isn't it? It's the people. So Alison and I, Alison Lawrence and I, so we set it up and administer it, but we're really fortunate because the group was so engaged and creative, and that we're now like we're quite democratic, and people are up for development. So it's working quite well at the moment. So I'll run through those 4 visits. We've done more visits since, so you know, this is going to be ongoing. But I'll run through these 4. So we're about raising public awareness, so that communities as a whole, alongside professionals, can play their part in preventing, identifying and responding to safeguarding adult concerns. And we were given a brief by the board, and we kind of started with the kind of usual people that we understand and we work with all the time. It was services around homelessness, substance misuse, mental health, all the services that would work with the more socially isolated, marginalised people. And we've done a lot of work there, but then we kind of realised that that's in-house work. It's not really, we wanted to go beyond that to what we saw as the community that weren't necessarily involved in health and social care work. And so we went, the 4 groups that we're going to talk about are there on the second slide. We went the submissions carers group, we went to Paulsgrove Men's Group, Diversity Lounge Social Club, Cross Cultural Women's Group. Now I can speak with more confidence about the Submisuse Carers Group and the Paulsgrove Men's Group because I was there. I was one of the people that went. The Diversity Tea Lounge Social Club, the Cross Cultural Women's Group was taken up by other group members. So we'll just talk about the overall findings. I'm on slide 3 now. So there was a general lack of knowledge, but it's interesting that Councillor Hunt was just talking about community safety, because that's where people started often when we spoke about safeguarding. They pretty much went straight to community safety issues. So they were saying, yeah, I feel okay, I feel safe enough during the day, but if I go to shops at night and there's young people hanging about, then I don't feel so safe. And they would talk about vandalism and graffiti and kind of general community safety, maybe antisocial behaviour issues. So we were fine because we understand we need to be where people are and kind of listen to that and move through, and then kind of move into talking about safeguarding adults. And we didn't want to get too technical. We didn't take a flip chart and go through the Care Act. We didn't start talking about Section 42 and inquiries and the three-stage test and what that would look like. We just wanted to really engage people through talking. We had a few questions which we've developed over time, which is really just quite simply, what's your understanding of safeguarding adults? Would you know what to do? Would you know what to look for? Really kind of basic, and we're developing them as we go. So people were pretty much on community safety, but they did identify experience of abuse and neglect, sometimes for themselves, sometimes in their family. There was a really interesting one at the men's group I was at, whereas one of the people, it was like a light bulb moment. He considered that his daughter might be the victim of coercive and controlling behaviour, because he tracked the relationship and what his relationship with his daughter was, and how it had changed over the year or something with his partner, and what it was like now that he saw very little there. That the partner would wait in the car, she'd run in, say hello and run back out and away, and he thought he wasn't quite sure what was going on there. And I liked it, he was really sensitive about it, because he says, because we didn't want him blundering in saying you're do you know what I mean, you're at the receiving end of coercive control and behaviour. He says, no, I'm just going to have a gentle conversation with her. He says it's gave me a start point to actually talk to her about what might be happening, which I thought that alone was kind of worth the visit to the men's group. So yeah, so people identified more as they went through. They tended to think initially that it would always be the police that they would seek help from. They weren't. Very few of them knew about that they could bring their safeguarding adult concerns to the council. They valued the community group really highly in terms of where they could share how they were feeling, their life, the community. So I'm on slide 4 now. So their overall findings. So the two groups where there was non-English speakers, they were the ones I wasn't at. The group facilitators is really vital to support translation. We had people who could translate, facilitating in those groups. The prompt sheets were intended as icebreakers, but they would just compound the lack of knowledge around safeguarding. And as I say, tended to go to community safety. They all liked the pens and the cards, which we hoped they would. So will you when I bring you your pen later. The out of hours wasn't known about either, and so we were able to just inform people as well as part of being there. If we came away and people were more informed, then what we were doing was working. So I'm on 5 now. The cross-cultural women's group. There's a lot of discussion around domestic abuse, control and behaviours, and the kind of and the cultural issues attached to that, there was a lot of sensitive conversations around that. The people that were there explained the support that could be given, and because people wanted to remain in relationships. So so rightly so, it's about support, and it's about understanding where that support is for now, or if things deteriorated and got worse. The Paul's Grove men's group, that's just a bit about what I just told you about the fella that identified what might be going on with his daughter, and he decided that he was going to kind of sensitively broach that with her. The diversity, again, I wasn't there, so I'm kind of reading off I'm reading the same as you are here. So, but they would have used the props we had, the questions to start the conversation, the little quiz at the end, and feedback forms as well. That's a crucial part. We set people at the end. We build in the kind of time where people can, and the feedback is about what did you know about safeguarding, what do you know now, would you know where to go, so on. And sometimes we sit and do it with the person. It's their choice. Some of them want to do it themselves and give us them. We then collate that and report it back into the subgroup, and then we praise that again and report it to the Safeguarding Adults Board. So one of the things that were coming through is people didn't always know the neighbours' degree of people feeling safe and unsafe, depending on their experience or instance of antisocial behaviour they'd come across. And there was some concern around the lack of services. Some people felt, especially in the Diversity Tea Lounge, that there wouldn't be help if they asked for it. So part of our role is kind of reassuring that there is help and support available. People don't always know what we know, and that's why we wanted to get out in this building and get into community groups. So general lack of awareness of what Safeguarding Adults was available, and of course rather than the police, which everyone knows about. So feedback for Group 3 I can talk about. The Submissions Carers Group, now, it took us a while to get to what we wanted to do. Because I used to manage the submissions services some years ago, so I knew the group. So they remembered me from 8 years ago when I was there. Somebody remembered the date. But, so we got talking, and it more or less moved into the same as it was the last time, because I think they're quite a closed group. They don't get to communicate outside their group, and they hold quite a bit of angst around services that they needed to vent. So we spent quite a bit of time with them venting, mostly about their experience of mental health services, the lack of understanding over the years of co-occurring conditions and kind of mental health and submissions. And we got through that, and it turned out, because the person that chairs that, she made a really good point at one time, because people were talking as if, there's a real good point to this, is that they were talking as if it was current. And she says once, but Fred, that was 8 years ago, wasn't it? That was like, and he says, yeah, but it still riles me. And that was kind of interesting in itself, that we should be able to understand that and support that with people, that if you perceive that your family or you got such a bad service at any stage, you're going to bring it with you. You're going to bring it with you into mental health services today are rubbish. And so we done a little bit of updating about how mental health services had really kind of moved forward. We told them about the hub, we told them about access, and we told them about the closing the gap between primary and secondary service. So they were quite impressed and think, okay, that kind of sounds good. That wasn't your experience then, but that sounds good. Then we were able to get to what we wanted to get to, and we had a really good group. And I think that's because they meet for 2 hours, so we had plenty of time. I mean, our bit, we only need half an hour, but so we were able to get through that. We were able to get to where we were. So that there you are, talks there about the negative experiences, police, mental health services, some feeling aggrieved, and there was kind of concerns around the criminalisation of substance misuse, but that's the culture we live in, and also they felt that there was a kind of bit of lack of support for them. It was interesting that they thought as carers there was a lack of support for them. They were actually in the carer centre at the time, and they are welcome to be, and they have a key to be there. And I did say, you can do more here. You don't need to just come here for 2 hours on a Thursday. You know there is a lot more support in the very building you're in. So hopefully people have taken that up. So the kind of takeaways that most people we spoke to could identify some instances of abuse and neglect. Some in their families, some in the community. They weren't that sure what they do in the community. There's always a sense of getting people into trouble. And we discussed that in our group as well. People, the fear of if you involve the authorities to your neighbours, you might get someone into trouble. So it's like that balance. So people might feel that at first because it's a state, but actually you'll also might be doing somebody a really good favour and getting them the support they need. So it's really that to consider. So kind of low understanding of adult safeguarding and support available. Again, people are much clearer about community safety, and we decided we should link in more with community safety and bring back what we're getting told, which sits more in the domain of community safety. So I'll move on now to where we're going to go next. We're going to keep visiting the community groups. Since these four, there's been various to various community groups which we continue to feed back to the board. We've got plans to capture video feedback because the board have always been asking for the voice of the people, so we kind of bring the voice in written word, and we're now thinking, okay, we can move this on, because the feedback bit, by the time you get to the feedback bit in these instances, there's trust in the room, and I'm pretty sure that some people would be happy to give their feedback by video, and we would assure them that video doesn't go anywhere. It only comes to the PSAB. It won't be on any social media outlets. It won't be there. So it would just be little snippets of the questions instead of them filling it in. There's only about 3 questions. I'd ask the questions. I'd record it on my phone. Our comms department, I've says I can take the little pin on mic with me, and then we can bring that back. So that's the plan. So those discussions are underway. There's feedback from the groups that professionals find it difficult to engage with. Now that's one we're struggling with as a group. There's one person, there's a social worker who works with the most kind of marginalised street homeless, with all the kind of health and social care issues that go with that, and some people are really entrenched in that position, and they find it really difficult to reach some of the people that they're there to work with. And we really wanted to find a way to get the views of those people around. Because often when you look at kind of peer recovery and peer movement and service user engagement, you often get a lot of feedback from people when they've maybe got over something and they're okay with services and they understand the partnership, and then it's going to be quite positive generally. I think we need to seek out the stuff that isn't so positive about us that we can maybe do something about. There's always been the notion that almost when you're better, like when you're better, your feedback will be better. Well, that's not okay. So we need to value what people are saying from whatever position they find themselves in. So so we got plans to undertake a more comprehensive communication campaign. Sometimes I think there should maybe be some kind of national TV campaign around safeguarding adults, because it really does touch on lots of what Councillor Hunt was just saying. I mean, it touches the community in lots of ways, and it's almost like if people can understood for themselves, even perpetrators understood what harm and abuse really kind of looks like for the victim's point of view. So we'd love to keep the campaign going. We want to continue to ensure the engagement subgroup represents as wide a section of the community as possible. We want to upskill the subgroup to act as safeguarding champions to support and cascade good practice. And we're going to set up a stall at the World Social Work event to promote safeguarding practice, learning from SARS and audits. There was mention of partnership there and how important it is. I was speaking to one of the directors, the communication engagement directors in PCC, and I was saying how we sometimes we're a bit siloed about what we're communicating to the community. So it could be that they've got an agenda and they go out to communicate that. What would be wrong with talking about adult safeguarding in the midst of that conversation? What would be wrong with making that a key point that gets discussed, regardless of what the agenda started off as? And they thought, yeah, we should really partner up. We should broaden out our messages rather than going with this message and then going with that message, then going with that message. You know, we should just get into conversations with people and bring safeguarding adults deeper into community consciousness. That's me for now, so thank you for listening, and if anybody's got any questions, I'm happy to answer them if I can.
Thank you very much. I thought you might, David. Over to you.
Thank you. I really want to commend Dave and Alison Lawrence, who's the business manager, for the work that they've been doing. We set up that subgroup a couple of years ago at the board, really to do exactly what Dave has just described. And I think what's come through to me more than anything else about that presentation is the need for a longitudinal approach. You need to take some time to really engage with particular communities, and particularly to those that don't ordinarily get consulted with, because there's an awful lot of consultation that goes on, and this group often hears about it, but it seems that there are still people who don't get heard. It strikes me there's a real skill in what it is that has been described, and it's really interesting, I think, to hear how that group has developed its skill over the couple of years it's been running. It also shows to me, I think, that safeguarding is really complex to get it across to the public, whether that's safeguarding children or adults. And the need to engage the public and to educate the public about safeguarding, I think, is also demonstrated by Dave's presentation. In my safeguarding world, I sit on a number of health and wellbeing boards, so I've got the privilege of comparing them. I have to say to you, this is the best one that I sit on. It's the best one because of the join-up. That there is a real sense in which there is a joining up of the system in the city. And I would like to invite the board to support the work that Dave and Alison have been doing. If there are pockets of change at the back of the sofa somewhere that the board can make use of, I'm sure we can get some more pens and usefulness out of that. But also to find a way in which that work in the subgroup can be bolstered by other initiatives in the city. I think it's great that it's come just after Councillor Hunt's presentation about community safety. Thank you.
Thank you, David. Any other comments or questions? Thank you very much, Dave. So really appreciate that as an update on that subgroup, and I think it's you're quite right. It's dovetailed very nicely with the community safety presentation we've also had, and it's something that we should be very proud of. And David, thank you for your very kind comments, and I certainly echo that in terms of we have worked really hard over the years to have this as a really inclusive health wellbeing board, and actually does lots of really good practical things rather than just being just a talking shop. So again, I'd like to thank everyone, and thank you, Dave, for your presentation of the work that's going on.
Thank you, Mark. So, if you don't mind. Thank you. Yeah.
Just turn your. There you go. Thank you. Okay, so on to the next item, which is the Portsmouth Safeguarding again. Portsmouth Safeguarding Children Partnership Annual Report. Over to you, Sarah.
Thank you. It's almost as if we planned this. Yeah. So, Lucy and I are here to present the yearly report from the Portsmouth Safeguarding Children's Partnership. And just by way of introduction, you will note that in the yearly report 23-24, we had an independent chair, and that was Scott. And you will see on the heading of this presentation, we now have the chair, and that is me. Because there's a review of the multi-agency safeguarding arrangements that came out nationally. There was a recommendation that all independent chairs were removed from boards, not for any reason that they weren't doing a great job, because they really were, but that the role of the independent scrutineer was more formally developed, and that is where our independent chair has moved into, an independent scrutineer. He will provide that high support and high challenge into the board. And there was an ask that out of the exec membership of the partnership, which is children's services, police, education and health, that we nominated a chair. And I stepped into the chair for the first round. It will be handed over and shared out between us. But that's why there's that slight change in that language and name. But I'm going to be handing over now to Lucy Rylett, who makes everything happen in our board and was certainly responsible for the collation and preparation of this board report and the summarised presentation. So, Lucy, over to you.
Thank you. So, Working Together 2023 came out mid-year for us. It came out, we knew it was coming, it came in December. So for the annual report, what that means is it's now more prescribed within Working Together. But as it came out midway through the year and changed our working arrangements, as Sarah has alluded to, this yearly report may not seem as exciting and proficient as others, as it was a period of great change for us, as the responsibility that came from Working Together in 2018 has been further enforced on our 3 safeguarding partners, so that they are more responsible for and accountable for the safety of children and young people within our city. So we're still working to the same strategy. So we have that consistency in our approach that we have taken forward, so that that integrates into the Children's Trust Plan. And we work closely with our colleagues across Hampshire, Isle of Wight and Southampton. And we have great relationships with the Adult Safeguarding Board and with the Portsmouth Education Partnership, which we will seek to continue to strengthen, to make sure that the 8 priority areas that we have in our safeguarding strategy take account of and kind of reinforce and support and complement, that's the word I'm looking for, the other strands and strategies rather than duplicate them. So you'll have seen the 8 priority areas that we have, and I've just chosen to highlight a few of those areas because I know that you're all very busy people. What I want to bring your attention to is when you look at the effective early support and help, which is what we need to have in place to ensure that when there are serious safeguarding issues and significant harm, our social care services, the statutory, aren't so stretched dealing with everything that they can really focus and put that help in for families. But what you can see is that our contacts into the MASH, which is our front door for children's services and is multi-agency, you can see that they've increased exponentially over the years. The number of contacts and the number of children those contacts relate to, we look at both those figures and you can see that that has gone up. And we know that we're getting better at identifying concerns through our great training programme we have in the partnership and our workforce development. But we also know that because of social and economic factors in the city, that there is a greater increase of harm for our children. And with our preventative services that we would have asked to work earlier, so our pastoral teams in schools, our health visiting, our school nurses, our youth and community services that we heard about earlier, they're reduced because of cuts in public spending. So what we see is where we would like to put more effective support in early, and we introduced the family support plan, which has been great in terms of unifying how we provide that support to families and having a common language, because those services, the pastoral support, just isn't as available, isn't as proficient as it was before. It means that those concerns are being left until they need a much more statutory response from either our targeted early help and prevention service or our social care services. But we know that they are doing a fantastic job with the ILACs that happened in 23. You know, there's an impressive early help service that is a strength, and they commented on the partnership working and the robustness of that. However, we also know some of our strategies that we've tried to put in place, children experiencing neglect. Neglect has been a priority for every safeguarding partnership, back to safeguarding boards, back to area child protection committees, if you've been around long enough to remember those. It's the same concern, and we need to maintain that focus on it. Child sexual abuse. In 22, we saw the launch of the HIPS, Hampshire, Isle of Wight, Portsmouth, Southampton, Child Sexual Abuse Strategy, which has a toolkit that sits alongside it. We have had a much sharper focus in Portsmouth on delivering a plan that responds to our local services and our local needs. So the strategy, the toolkit, the resources will be common, so we have a common language across our services, but we know the demographic and how that lands for our children in Portsmouth. We need to make sure that it's tailored to them. So you will see that we are starting with that implementation, and the new working together is required that we focus more on the impact of these strategies and toolkits. So hopefully in the new iteration of the yearly report that I'm about to start writing in April with the support of our partners, you will get a greater flavour of the impact these have had. And I'm going to lean into what David has been doing and that great work, and arrange some time to think about how maybe we can duplicate that with some of our children and young people in the city. We need to recognise the first presentation we had, and I'm terrible with names. I know Caroline, I can't remember the councillor's name. Lee, thank you. Extra familial harm. We lean heavily into the community safety partnership. They sit hand in hand. Since we've had a new head of adolescent service, Keely Mitchell, within Children's Services, she has done a fantastic job, if you read the plan, of bringing together our multi-agency partnership to focus on the missing, exploited and trafficked children in our city. And we now have Safe For Me plans, we have contextual meetings which look at the places and spaces and the people in our city who wish to cause the harm. And we also have our youth offending service who work greatly with our with those teams to think about the prevention of young people entering into offending, so that we can focus on the prevention. But also we recognise that the harm does not end when somebody turns 18, unfortunately. So we've been working with our colleagues in Lisa Granger, who works in adult services, been working closely with Keely to think about the transition, what happens. So we now have a young adult safeguarding panel. So these are young people who don't have a need as defined by the Care Act, but these are young people we might want to consider under what's known as the MUM, the Multi-Agency Risk Management Framework, so we can think about developing a plan with them of how they can continue to be supported. So these are some of the strands that we've taken forward over the past year. Finally, I want to tell you about a great initiative that I think has really responded. In Portsmouth, in the year that this report is, we didn't publish any what were called serious case reviews and are now a local safeguarding children partnership reviews. It didn't mean that we weren't considering incidents of harm that had occurred to children. And what we know is a recurring theme is how agencies talk to each other, what happens when there's a difference of opinion as to how we should respond to a child, but also sometimes we get stuck. We think we've tried everything, it's not working, what can we do? And sometimes in that stuckness, we freeze and the family is left in limbo and the concern is left to continue. So, Sam Nesbitt, who's our training manager, has developed this approach, Rethink, which is to strengthen multi-agency working. And what it does is it pauses and allows for a meeting of the professionals together to think about what's happening, what have they done, how are they working together, and think how they can go forward. Because all the other meetings, we have the families there, which is right, but sometimes we need that space just to talk to each other and to challenge each other and to have those awkward conversations, but in a safe, facilitated space. And we are doing an evaluation of Rethink, which hopefully you'll have a taster of in next year's yearly report. I know that you're very busy people, so I won't take up any more of your time. I would really encourage any of you that wish to come and see more of what we do. You're very welcome to come and shadow one of our partnership boards. Our website has lots of information and more details about us, and if you wish to contact me to find out any more and be in touch with our partnership, we're at pscp@portsmouthcc.gov.uk. Thank you.
Thank you very much, Sarah and Lucy. Any comments or questions? Yeah, David.
Yeah, thank you. You have inspired me, because I was thinking as you were talking, as I was talking as well, actually, because there was me saying we should kind of broaden out what we're delivering, and we're there talking about adult safeguarding. And we do touch on children's safeguarding children, because you'd need to, because people will bring that into the conversation. But you've kind of inspired that we probably don't say enough, so we should get together. That's what we should do, yeah.
Thank you. Any other comments or questions? Oh, yes.
Just to emphasise the link between we've got a rather fragmented education landscape in Portsmouth, as in many local authorities, because of the multi-academy trusts not being local authority schools and things. So I think there's perhaps more that the partnership board can do to just share with the sort of strategic board members to make sure that it's not just the heads of the school principals that are being involved and informed, but those senior leaders within the trusts have a picture of the wider happenings in Portsmouth, because often it just channels through a designated safeguarding lead and then into the local authority. And they're dealing, the trust itself is dealing with multiple local authorities and might be missing some of the wider, richer things and that are going on specific to Portsmouth and specific to Portsmouth's context. I mean, Scott did come to the board, so perhaps that's something that we need to make the connection with.
Yeah, I mean, I'm obviously sitting on the partnership board, so I straddle the two, so absolutely can update. And obviously, Mike, as the education lead in the city, is now a named kind of member of the multi-agency safeguarding arrangement as well. It means that he is proactively bringing information into the safeguarding partnership, but also has weekly communications that go out to schools and ensures that that feedback is in there. But yeah, I take your message. If we think that there's more to do in terms of the safeguarding work overlapping back into the partnership, then we can certainly take that forward.
Yeah. It was just the richness of things. Given my insight into Portsmouth is probably similar to some of the CEOs in the trusts. There are things that I'd missed, I have to admit, and therefore maybe there's just more that we can do. Okay.
Diane.
Thanks, Chair. I just want to say, I just want to cheer. I know it's not appropriate to sit in the board and clap, but the last two presentations were absolutely amazing. And something that's very tiny weeny in your presentation, and I'm hopefully not going off piste now, but I was terribly impressed that you produced 12% of your income from traded services. What did you do?
We have an amazing training team who I alluded to Sam, but there is Beck, Kelly and Hannah, to name check them, and they offer coaching, mentoring, but also training. So for our schools, they have the option to choose where they get their safeguarding training from. So if they choose to get it from the partnership, they obviously purchase that as they would do an external. And we have a great percentage of the schools that choose to come through the partnership.
Fabulous. Congratulations. Thank you so much.
Thank you, everyone. And thank you so much again for the report. As has been mentioned, it's inspiring and really positive, the way we are doing that partnership working right around that area. And then connected to that, we move on to the next item, which is back to Sarah for the Children's Services wider update. Can you turn your mic on, please, Sarah?
I certainly can, yes. So I've got, just close them all. I've got two reports just to bring some further information into the board. I'll start with the first one, which is the one that's titled ADCS Safeguarding Pressures. Every year, the wider network of DCSs submit data, financial data, child-level performance data into that central pot, and a broad review of what is happening across the country is then pulled together, and we can measure it back over a number of years now, which is really helpful to see those trends and those changing patterns in our world. So this latest phrase covers from April 22 to March 24, and whilst it talks about the national picture, bearing in mind what we've just heard out of the safeguarding report, it will be no surprise to hear that these are things that are impacting us significantly in Portsmouth. So the lasting impact of COVID-19, I think every one of our services around the table would recognise the impact that has been had around mental health, around anxiety, and also some contributing factors to social and developmental delay for our children. Families just feel like they are less resilient and that they're leaning more and more into support and services. And that is being felt in terms of the number of referrals relating to need that we see coming into our system. And you've seen that tidal wave of need coming through our MASH, into our early help, into our Tier 4 services. Housing, we know that temporary accommodation in the city is a significant challenge for us. We hear about that nationally. We sometimes hear about these things because of the financial impact and the burden that it's placing on authorities, but beneath that financial burden is so much need, so many families and children living in temporary accommodation across the country. We are really fortunate in our response in the city and the close working with our housing and neighbourhoods services. And actually the response to children and families in temporary accommodation in the city is incredibly strong. They spend a very small amount of time in that very, very temporary accommodation before moving into something more suitable for them. But we cannot underestimate the impact that temporary accommodation has on families in terms of the pressure and the distress that can cause. And it's normally resulting from breakdown of wider family support, because many of these families have been staying with family and that's ended. So health challenges, we know the impact of health on our families. We feel that in our system. We've already spoken a lot about adults and their needs within the city, but that poor mental health and the impact of parental mental health on children, on their kind of social experiences and their life chances. And in the country as a whole, and this is where we are a little bit different, we have seen parental mental health taking over from domestic abuse. That isn't the case in Portsmouth. It's very high, but domestic abuse is still the most common factor for us in the city. However, we very rarely see domestic abuse without mental health without. So it's very difficult for us to unpick those. And I think the other piece within health is often that challenge for the voice of children to be heard in the ICB. We are very fortunate, I think, within our Hampshire Isle of Wight arrangement to have a strong kind of children's-led element of that partnership arrangement. But with the challenges in hospitals, with the challenges of waiting lists, with the challenges of winter pressures, we know that children aren't always managing to be the priority because of the reactive need. So then the other areas that were of note but weren't as significant, poverty underpinning so much. We work in an area where there's significant deprivation. We know that within those postcodes where our most deprived children and families live, we see the most need. Those children have poorer chances in life, and we see that across education, health and their social experiences. And we see them as a result of that more frequently in our safeguarding system. And then placements. We've spoken, I've spoken, I spent a lot of time talking about placements for those children who are our most vulnerable children, who are suffering the most significant harm, who then end up in our care. Sadly, and again, this is highlighted in the news all too often, we know that there are not the placement choices and the homes and the care available to those children. And significantly, our most complex and our children who have the greatest need are often those in the arrangements that are not legal, in the arrangements that are temporary, they are being cared for by often the lowest skilled and the poorest paid. And we have to question how we respond to those children and those families in our systems. So an awful lot of work being done around sufficiency. But often those children are also costing us £60,000, £70,000 a week, and that can't be right. They're certainly not getting £60,000, £70,000 worth of care. And we have to realign, and we have to invest in our earliest help to prevent those children's needs becoming so significant and for those children's lives to be so distressing. We're doing significant work across the South East as part of a Pathfinder, which is the Regional Care Cooperative. We are seeking to work as a group to challenge those excessive costs, to work better and closer with providers, to challenge that whole piece around profiteering. We're also looking at increasing our capacity of sufficiency in terms of homes, in terms of foster carers, and to ensure that our children can live more locally, but working more collectively. We don't want to be competing with one another. We want to be working in a joined up way. So we are really excited about the potential for that, about if another part of that work is for the government to start to challenge that profiteering. And if at that point we see providers stepping away from this work, we want to be ready to step in, to take over those homes and to enable us to continue doing that work. So whilst it's probably one of our biggest areas of challenge, it's also now becoming one of our bigger areas of opportunity. And then the last factor, which again we've touched on, is that piece around exploitation, trafficking and gangs. We know those numbers are increasing, and potentially that's good news because it means we're better at spotting it. But actually those gangs, those traffickers, they're smart, they're clever, and they're always 1 or 2 steps ahead, and we are running to catch up. They can offer our young people excitement, money, things that we simply can't, but we have to be better at working with our young people to help them to develop their own safety plans, to work with the communities. Again, we're back to that point about how we can all work together to increase safety in terms of environments for our children. But as Lucy's already highlighted, some amazing partnership work being done in that area, both for children, but critically for those transitioning into adulthood. So effective work being done, but it is all consuming in the city at this time. So that's just a snapshot of what's happening nationally, but also very much what we're seeing locally. Okay. I don't know if anyone's got any questions.
Thank you. Thank you very much, Sarah. Any comments or questions? David.
Again, across some of the safeguarding work that I'm involved in, it's increasingly clear to me the numbers of really complex cases, both for children and for adults, which are COVID related. And I'm just wondering whether or not there is the need in the city for a joined up COVID response in terms of the impact that has had. I think it's now becoming clear for children. And I think, as Sarah has indicated, it's becoming more and more clear for some families too. I'm sure lots of good work is going on, but I just wonder whether or not there is the need for something more joined up.
Helen.
I think it's a very good challenge, David. I think it's you can't separate it. I wouldn't say it is actually due to. It's due to the decisions and the outcomes of COVID, which are very well known now. I don't actually. Sarah and I had a conversation yesterday. Do you think if we had another pandemic, we would be closing schools and lockdown? And I don't know the answer to that. But what we do know, and actually I think we're in the actual national review of all of this work, the inquiry, is at phase 9. We've just completed, Sarah's just completed the children's, young people section. We're on test, trace and isolate at the moment. And I think the reality is, I hope that the learning will be taken into consideration. I mean, there's so many elements of it, David. So the emergency planning process hasn't stopped. That continues. Plans have been updated. They're being tested. The inquiry, hopefully, will bring out a lot of the evidence, which we're now very aware of, particularly around mental health, particularly in children and young people, but also in adults. So I hope all of that is now, and you can see here today, it's been taken into consideration, because I don't think there's been a paper today that hasn't had an impact from that period of time. So I don't know, can I think about it, whether we need something additionally, because we're all working in extreme pressures to actually take that learning and adapt. And I think we are all doing that as public services, all partners around this table. I mean, just thinking the university did a huge amount of learning around teaching in those circumstances and the impact on students. You know, it wasn't just children at school, it was also students. So I think we need to take it all on and keep going, moving forward. Because what I do know, sadly, is that there will be another pandemic. What we've also got to take into consideration is decisions that government will make in terms of, so there's the planning, there's the preparation, and then there are then decisions that are made on a daily basis through these emergency situations. I mean, pandemic's likely, you know, we've also got other risks. We're talking about air quality later, which has a huge impact on same risk for climate change. All of these things, unfortunately, are going to be part of our life going forward. I don't want to be too depressing, but so I don't know if we need to do additional work. I think what we've got to do is make sure that we're taking the learning in from the independent inquiry, but also from all of our learning on the ground. And I can see through adults and children's, and it will be the same in organisations, we have adapted and we have changed and continue to do so. Not a great answer, David, but I need to think about it, and perhaps we need a conversation.
I guess I was just wondering that there are now a number of children and adults who need repair, which is it's slightly different from how do we learn lessons from the experience of the pandemic.
I think that's a good challenge. I would hope, and I see, and Sarah might want to come back, that work is underway, but again, in very difficult financial and pressured situations. I think Sarah made the good point at the beginning, that doesn't always feel like children are prioritised. And I do know, I'm just looking at my NHS colleagues, the pressures on a daily basis in the system to be able to deliver against, you know, waiting times, delays, the financial challenge. But I also do see changes in how mental health services are being delivered, both for children and adults. So I think that work is there. It's not going to be overnight. This is going to take time. So I don't know, Sarah, if you want to say anything specifically.
I guess we don't badge things as this is COVID repair, but I think we have done, as Helen's just referenced, and I was going to pick up on, the immense amount of work that's been done in terms of mental health in the city and our response to children, the mental health response to schools, the online support, development and further development of CAMS and the SCMH pathways. It's not got the tag of COVID on it, but it absolutely leans into the fact that we have children with mental health and anxiety at the level that we didn't have prior to COVID. And I think the other lean has been the family hubs work and the Best Start for Life work, which again is looking at those children and those younger parents or first-time parents who perhaps have lost some of their resilience, and how do we bolster that? And that's very much a universal. But what I'll come on to next is a piece of more intensive work with families that will be really seeking to do some repair around those children who aren't as ready for school, aren't as ready for work, and actually what does that mean for us as a whole system, and how do we lean into that without absolutely leaning into COVID, because we could also pick up our mobile phones and say, well, what did these do to society? And it's sometimes difficult to unpick the contributing factor, but to make sure our services are open in a way that meets need, as opposed to targeting it on a label. But I think you're right, we also have some thinking to do about some of those more complex children within that.
Thank you. Okay, and thank you so much for that. I think having that national context with the local context is really helpful. And Helen was just mentioning about restrained financial situations. Well, unfortunately, they might be getting even more restrained after today from what we've been trailing from the Treasury, unfortunately. So watch this space, and as we also, all we seem to do at the moment is just look out for when the next funding cuts are going to be, what the next restraints on our funding are going to be for all public services, and for partners as well. Sorry to be a bit depressing there, but we have to be realistic about what we're able to do in all those contexts. But I do think with David, I think it is a good challenge, and something that I think, again, from what you were saying earlier about the way that we work together, we are inclusive here. That it means that ask is now out there, and it's been heard by everyone around this room. To Helen now for Health Wellbeing Strategy Air Quality. Oh, sorry.
Really sorry, it's all about me today. No,
Sorry,
it's not all about
Sarah.
me. I've got one last paper, which is a really important paper, actually. It's around children's services transformation, because we didn't have enough to do already. And this does come with money. Because we are a city that has significant pockets of deprivation, as we all know, there was a prevention grant developed by the government, which leaned into financially which areas were more deprived. So we have been given a grant to deliver transformation in children's services. Not new money. That's old grant that's been taken away and repackaged, and so there are things that we won't be able to do anymore that will be reinvested in this. And I think the important thing, just before I start this presentation, is this is 1 year grant. So, just with that, I don't bring cynicism, I just bring caution. So this comes out of Josh McAllister's review, that wonderful, this once in a generation opportunity to change the way that we work with children and families, and a real opportunity to rethink the way that we deliver services and lean into outcomes. It also looked at other areas of the legislation, but it also, once it finished Josh's piece of work, then brought in those outcomes from Arthur and Starr, those sad children, those sad stories about those children who died in very, very distressing circumstances. The government pulled all of that together, and they produced an aspiration and a desire to work differently, to help keep children safe, help families thrive. And that's that policy statement that we see coming down about how we might work differently to achieve those better things. So, whilst not clearly set out in guidance yet, there have been a number of pathfinders over the country in the past year, and we are expecting detailed guidance in April and further detail about the reporting back into government as well about the impact of the work that we will be doing over the next year. But what we do know is the aspiration to create better family help. This is where I get really excited. This is where I think this is something that can really help us in Portsmouth, because what we do want to do is work differently with our families. We are relational. We aspire to be the best relational city that we can. We want to work with our families and with our communities to better support our children, rather than doing two, rather than bringing them into meetings where it's a table full of professionals and two poor parents sat there feeling intimidated, scared, and worried about what might happen. So a real opportunity to think about a team around the family that is a reduced person then working with them, but having that support around them that they can dip into, to really lean into family group decision making at the earliest opportunity, where the family is absolutely at the core of that intervention, and really thinking about that from the earliest point. We can't suddenly expect families to work with us in a certain way at tier 3 or 4 if we haven't been doing that when they were at tier 2 and first identifying emerging needs. So they talk about the development of a family help lead professional role. Well, we've got early help, but our early help is sitting really high up the system. In other areas, that potentially might be tier 4 work, it might be children's social care work. So what we want to do is expand that piece of our world so it is leaning really into tier 3. And actually what it's doing is leaning in to support our tier 2 services, so that, as we've heard, those schools that had their pastoral care taken away, how can we better lean into them to support them to identify emerging need and work purposefully with that child and family at that point to address that need and to divert that need. So within that, we think that's really fantastic, and we're really keen to build on the work that we've already started in the city and to really enhance that, to really bring together agencies. Now, it's quite prescriptive in terms of who they want around the table in that respect. You know, that talk about probation, police, health visitors, midwives, education. What we know is those services are already struggling to do their day jobs. They're already resource stretched. So actually saying we want you to step away from that and come and sit round our table in this world is I think, a stretch too far, and actually diverting resources away from where we want them to be. So I think we need to think a little more carefully in the city about what our ask is of other agencies and how we do develop that work. We've done some very successful work in Tier 4 around the family safeguarding model, and we've got Dave here who helped us initiate that model, which is around having substance misuse workers, mental health workers, and mental health, substance misuse, and domestic abuse workers. Mental health, substance misuse, domestic abuse, I always get them all muddled, who work with the adult, because we can't change children unless we support adults to be more resilient and to meet their own needs. So we would love to see that starting at an earlier point for those children. Don't wait till they're at Tier 4 crisis. Let's start and let's work with those parents sooner. So we really want to think about extending family safeguarding. The other area is integrated front door. Great news. We've got a strong MASH. We know we've got a strong MASH, and that's well worked as a partnership. And we need to ensure that is maintained and, where possible, improved and enhanced. So there's an aspiration to have a single assessment and plan. These things sound so straightforward when you put down a piece of paper. But if we're going to ask everybody in the city to do the same plan and input it into the same IT system, we'll probably be talking about this in 100 years' time. So I think there are some things that we know are not going to be achievable within a year. So let's not spend too much time on those. Let's be selective about what we pick out of this. In terms of implementation and support, we've already talked about local protocols. We need to just look at the work we already have in place. But also we have strong workforce. We've talked about the partnership. We've got that. Let's just build on that a little bit more. Let's lean into the other pieces of work that our workforce in the city need to strengthen the family support plans that we know so many of them want to do but just don't have the capacity and sometimes are slightly scared about. Some of this is quite scary and intimidating if you're not used to working with families in a certain way. It's intimidating for some of our Tier 4 workers. So how do we skill up and build confidence to do that work through further workforce development, coaching, supervision and dip-in sessions? Now, this is where I'll try and put aside my cynicism, but multi-agency child protection teams. We had a visit from Ofsted last year and they told us we were outstanding in this area. Now, I'm not someone that likes to break something that's working really well. It causes me quite significant anxiety. And again, I've already said there are areas we'd really like to invest and lean into. But there is this desire for the person and that multi-agency team to hold responsibility for that child through the system. Now, that sounds great in terms of relationships, but when that work reaches a tier and a threshold where we're talking about really significant harm and complexity, we are talking about that still being held by a differently qualified practitioner, but a team of people then coming and wrapping round and supporting that practitioner to manage that work. So they're talking about those multi-agency teams being police, being health, being education, and sitting together and working together in a way. Now, again, I like my police to be police. I like my schools to be teaching their children. I don't see a lot of people sat twiddling their thumbs. We did have a lead professional role that incorporated our health visitors. We've just moved away from that because we wanted them to be health visitors. So we've had a challenging conversation with the DFE about we're not sure this is quite our solution. There's more we'd like to do at that kind of route, but we don't think we want to unpick what's a safe, solid system in our city at this time. We haven't heard back. We don't know what they're saying, but just our area of reluctance is this. And interestingly, from the Pathfinders and from the learning from the Pathfinders, there has been real challenge in getting all of those roles together because there just simply isn't the capacity within our world and our systems. And at the moment, the expectation would be that we would use the money we have this year to second roles in. What happens next year? What happens when we've built a whole new system and that money isn't there? Bearing in mind we're probably going to hear there's even less money for next year. So we have to do something that's sustainable, that's going to not change our system enough that we then have to change it back next year. We've got to tread with caution in some of these areas, while still being excited about the opportunity and potential this can bring, because that whole piece about preventing children coming up into tier 3 and 4 would mean that if we work them lower down, we would release some of the money that we're currently spending that we don't have because it's negative money, because we're so significantly overspent. But if we can reduce that, we can at some point start to reinvest this back into the system. So there is that aspiration to build multi-agency partnerships with any number of different professionals. I'm just not sure how achievable that is in the current climate. And then the lead professional role. It would get away with our child protection advisors, those managers who are experts, who do have that responsibility for chairing those meetings and making what is probably one of the most significant decisions about a child's life. You know, you're leading them on a pathway that has a trajectory towards care, and it's a significant decision to place a child on a plan. The current thinking is that that would sit with an advanced social work practitioner, so somebody who's got experience as a social worker. There's another problem. We really struggle to retain our experienced social workers, and actually we're doing a lot of work in the city as a career pathway. But the last thing I want to do is tip that, because we're asking those practitioners to take on more responsibility and more risk in terms of that decision making. So again, I want to apply caution there, because where we're starting to see a shift in our use of agency and our stability, I don't want to lose that. Great thing here, parental representation in child protection. We couldn't want any more than that, the voice of our children and families. So one of the things we do want to take forward with some of the money is a huge piece of co-production. So I'm really interested, Dave, to hear what you've done in terms of that lean in, and appreciating again, that's not a 6-month job, that's a 3 to 5 year job in terms of real engagement and meaningful and purposeful. But what can we start to do in terms of getting those families who have experienced our system and who are currently experiencing our system more around our table to tell us how we might do things differently. And then, yeah, we've spoken a little bit about the multi-agency safeguarding arrangements. We've done that, tick, hurrah. Obviously, what we need to do is really establish what that does mean for us as a partnership and what that difference is, and actually really develop the role of the independent scrutineer so that they are able to bring that real strong challenge in, but also their support from other boards that they are engaged in. So we've done the work, but we want to see the impact of that. So our initial plans at this point are, we have appointed a programme lead for an initial period who will start to do some scoping. What have we already got? Where are the areas we really want to lean into? So we've got a really strong programme in place, but also a real strength to go back to the DfE and say this is where we want to lean. That's somebody from within our system who we've been able to move into that role without any disruption. So we're starting to establish governance group. They're not new, they're old ones. We're stopping some stuff. We're not going to create more boards because nobody needs that. But we will be leaning into partners and asking them to come around the table and start to work with us on this. Some critical starting of partnership communication and engagement, building on what we've already got. And as I've already mentioned, the analysis and stock take. Where are we already at? Where are our gaps? What do we want to do more of? And then we just await the launch of the detail. So fingers crossed, it does enable flex for us as a city to do what will make the biggest outcome changes for our children. So yeah, a whistle-stop tour, but there will be more on this as we get more detail.
Thank you, Sarah. Any comments or questions? Oh,
Just
yeah,
wanted to stress from Anthony Harper, who is our lead commissioner for children's, continuing to work really closely and really focusing on that early intervention and the opportunities that we can get from that, rather than undoing what is working incredibly well across the city.
Just one more point. We are really conscious, obviously, that we are Portsmouth Place wanting to work with partners who will be working across other authorities locally who will probably all have their own little views about what this new legislation guidance will look like in their local authorities, against a further backdrop of what our local authorities might look like in 2 or 3 years' time.
Dave.
Yeah, thank you, Sarah. I'm really glad to hear the plans for the Family Safeguarding Service and rolling it out. I mean, it just makes perfect sense, does it? Because if it works at that level, then it's going to work at a different level. And I also think you get a real payoff from that in terms of the community you're working with, because further down the road, some of those parents might actually be the people that are spreading the word, doing the work, the co-production. I think there's a lot of wins there. Yeah.
Okay, thank you very much, and thank you, Sarah, and we look forward to hearing more about this as it progresses. Now it is over to Helen for the Health and Wellbeing Strategy, Air Quality.
Thank you, and I will be swift because I think we've still got 4 papers left. So just to say, this is the normal annual update for one of the priorities for our health and wellbeing strategy. So this is air quality and active travel. I wanted to quickly start with some good news, which is that which is some outcomes. So in 2020, the early figure for early deaths in Portsmouth attributed to long-term exposure to particulate matter, which is what causes poor health from air quality, so CVD, etc., was 6.9%. It is now 5.2%, and that is comparable. You know, we do like to compare ourselves with the England average. We are a very deprived coastal city, very compact deprived coastal city. So the fact that we are now comparable is good, and I hope that continues to improve. So the important bit here is just, I'm not going to go through all of it, you've got the paper, but just to thank, as conscious it's a lot of the organisations around this table who are really focused on that important work. So I'll just pull out a couple. If I haven't mentioned you, it's not because we know you're doing the work. So some examples, for instance, Sustrans are working with the council and schools around school streets network, which is really encouraging children to feel safe and that they can active travel, walk to school, which I think is really important because it connects into what we've been talking about earlier in terms of parents' anxiety, children's anxiety to get out there, so really important. Royal Navy are doing a lot around clean energy options, which includes a 10-year on-site EV charging programme. While we're talking about I'll also mention Portsmouth Port, who are doing a huge amount of work in this area. So they are moving, and let's be honest, the port are they're a big user of energy in the city. So they are moving to battery storage, dedicated shore power supply, which benefits energy security, decarbonisation, emissions reduction. And they've done some amazing work with also the companies that use the Port Brittany ferries are introducing 2 new liquefied natural gas electric hybrid ferries from 2025, and the recently completed new terminal extension features world-class environmental engineering, including using seawater to heat and cool the building, wind and solar technology, and they've got 2 they've also got internal and external living walls. So I keep going around because there's some really good examples, but I won't mention everything. Obviously, it's the City Council's responsibility, and it's our colleague Rich Lee, who often comes and presents here, who produces the annual status report to monitor air pollution in the city, which is how we know a lot of the data. We've got lots of testing around the city, and obviously that feeds in to the clean air zone, so lots of focus. And if you look at the transport plan, which is let's be honest, it is transport which is the biggest creator of poor air quality. The clean air zone and the work that's being done is one of 4 strategic priorities, so it's really important. Coming to the NHS, lots of work going on at the hospital, around their clean air strategy, but also working around sustainable and active travel options for staff, but also patients, because we all know that I'm not blaming the hospital for this all, but the NHS are one of the biggest reasons that people do have to use cars, not only in the city but nationally, because actually there's so many people using healthcare services. South Central Ambulance Service, another leading the way, fully electric fleet by ensuring all new vehicles acquired will be electric by 2027. fire service, also moving towards electrification or hybrid support with charging points. I will mention Age-UK, Diane's here, but also Age-UK working with staff to reduce carbon footprint travel, and you have to travel over quite large areas often. So I probably missed somebody, but I just wanted to say huge amount of work going on. I know the university are doing lots of work as well, so huge amount of work going on across all of the partners. And the big focus moving forward of the Air Quality Board, so all the partners are on the Air Quality Board, which drives this work programme and feeding back. There's a real focus, because this is an issue for all of us, but the connectivity challenge in Portsmouth, where across the city we've got actually poor, active and sustainable travel connectivity, particularly when you're actually looking at employment sites. So that's a big focus on the kind of next stage of this work programme. So I'll leave it there. Happy to take any questions.
Thank you. Any comments or questions? Graham.
Yeah, thanks, Helen. I want to ask about the air quality zone, because obviously it's been in operation for a while and it's still operating, but it was concluded that it wasn't meeting its objectives. However, there's been a great wall of silence about what's happening in relation to this and whether anything is going to be done. What is going to happen about the air quality zone, and what is the proposal? Is there any proposal to do anything different about it?
I'm going to have to go back and check that. I'm really sorry. I should have asked before I came to the meeting. I don't know is the answer, so I will go back and we'll do a follow-up note. I do know it's under discussion, and you're right, it hasn't been seen to meet its original objectives. However, I do think we have to recognise that it has been part of the overall improvement in, and we have seen, if you get the chance to read the 200 pages of Richley's air quality monitoring report, you will see that some of the areas in Portsmouth that are monitored regularly have had an improvement in air quality. So I will get the information and come back to you.
Thank you, Helen. Yep.
Thanks. Great to hear there's so much going on. I was just wondering, I'm not sure it's for this committee or not, but whether any analysis will be done of this really fortunate period we've had where public transport has been capped at a certain fee, and now the prices of buses have now gone up quite significantly for some people, and what the impact that will be having on this kind of thing.
Yeah, can I come back on that as well? But I do know there's a big focus on, and there's a strategy around bus and other public transport within the city, but I'll come back. So we'll follow up on both of those.
Yeah, and there will be, with the latter one, there will be ongoing monitoring of those things at the Transport Cabinet members' decision meetings, so they have regular updates, because obviously it's the big, the bus service improvement plan, etc. And Graham, just on your points, I don't know any particular details, and obviously we'll get anything there, but I do know that it is, and it always comes down to what the government's department is saying that you can have, and we are really directed by them as a council, directed by them as to what the nature of clean air zones can be. So going right back, just to give some flavour, when we asked about could we make a clean air zone for the whole of Portsea Islands, they said, well, you could, but you'd have to pay for it yourself, and anything outside the area that the government didn't want you to do a clean air zone for, you wouldn't be able to get you wouldn't be able to retain any of the fines. They would have to go straight to government. So they do seem to work in a rather weird way, central government, with these things, and that was going back many years now, so back to about 2018, 2019. So it's not as simple as it can make out in terms of you can just come up with a new idea and then just implement it. It's all about A, government giving you the money to do it, and B, the government allowing you to take any fines to actually improve your things in your area, which is one of the reasons for having a CAS in the first place. It's a complicated subject, and one that that when we get that information we can maybe touch a bit more on. Any other comments or questions? Brilliant. Thank you very much, Helen. On to Pharmaceutical needs assessment, Matt.
Thank you, Chair. Conscious of time, so I'll keep this as brief as I can. Some of you may have seen pharmaceutical needs assessments come here before. Just for the benefit of any that haven't, it is a statutory requirement on the Health and Wellbeing Board to produce a pharmaceutical needs assessment for the area. And so we've produced this on your behalf, and what we're doing today is seeking your support for the draft that we've produced to go out for consultation. So again, statutory requirement to do 60 days of consultation, and then it will come back to this board for approval of the final version of those. Just as a kind of quick recap, it's called a needs assessment. It's not like a typical needs assessment. Really, it's a description of the pharmaceutical services that are available in the area that's then used by NHS through the Integrated Commissioning Board, for example, in making decisions around commissioning of pharmaceutical services, but also in response to applications for consolidation, for example, from pharmacies, and whether that creates a gap that could then be met by a new pharmacy. So we're quite tightly constrained by the statutory requirements of what needs to be in a PNA, and also recognise that we're operating within a constrained system across the rest of the region. So we need to be producing something that doesn't destabilise what is a fairly challenging market for pharmacies, as I'm sure you'll have seen from news coverage, etc., over the last few years. So that's the kind of context to it. It is a collaborative effort, so we do work jointly with colleagues from the ICB in drawing this up, and with neighbouring Health and Wellbeing Board areas as well, to ensure that we're reasonably consistent across the patch. So with all of that in mind, what we're asking you to do is approve the draft consultation that's set out as an appendix. I won't go through all of that. The executive summary highlights the key points, which is, so we've got 32 community pharmacies, including what are still called 100-hour pharmacies, but due to changes in the regulations now only have to open for 72 hours. So we've referred to them as 72 to 100-hour pharmacies in the document, but they are officially called 100-hour pharmacies still. We've got 3 of those in the city still, so good coverage on Sundays and into the evenings as well. We believe that because of the geographical coverage in the city, so no one's more than 10 minutes by public transport from a pharmacy. The pharmacies, there's a map on page 31 that shows how close pharmacies are to GP practices. I think the furthest gap between a GP practice and the pharmacy is 405 metres. So they are where they are because that's where GP practices are, and that's where people tend to need to access them. There's reasonably good coverage and good consistent provision of all the additional services as the report sets out. So we're saying that there are no gaps currently, but that we always maintain that kind of position that further reductions in coverage would have the potential to create gaps, and we'll use that, as we have through the last round, to, where appropriate, oppose any applications for consolidation that we think create a gap. There are always some where closures make sense, where it's difficult to oppose because there's several pharmacies very close to each other in a high street, for example, but in other cases where there are bigger distances, we have used the P&A process to successfully oppose those over the last round of P&As. I would also just add section 8 of the report from page 51 provides a summary of the demographic and kind of health population needs that underpin this work. This draws on the Joint Strategic Needs Assessment, and I just kind of draw it to your attention to say the P&A therefore provides you with the kind of current most up-to-date summary, so feel free to kind of refer to that in other things if you need to know what the population of Portsmouth is and the kind of health needs. That's all there in one consolidated document. So happy to take any questions on any of this, but ask you to approve the draft for consultation.
Going to bring Kelly in first.
Yep, thank you, Chair. And I was just going to pick up on Matt's point that this is one of the very few statutory responsibilities that the Health and Wellbeing Board has, which is slightly bizarre, but it is. And just, I think on behalf of the board, it's worth acknowledging the work of Helen, Matt and their team in actually preparing this and keeping that cycle running, but also the background work that happens in terms of responding to questions arising from it, responding to the P&As produced by other areas as well. So it's just to recognise that there is quite a lot of work that goes on behalf of the board, as I say, and one of the few statutory responsibilities I have, so well worth acknowledging that.
Yeah, and just on behalf of Neil Hardy, Chief Pharmacist from NHS Hampshire and Isle of Wight, huge thanks to you and James Hawkins and all of the work that the team do, and how welcome they have been into that process and that their feedback has been incorporated. So thank you.
Thank you, Chair. I just want to say how much I just love this document, and I have seriously read it from start to finish, and will be quoting it elsewhere, so thanks, Matt. The one thing that leapt out of the map on page 31 to me was that if anchorage goes down to 72 hours, there's a potential challenge there, possibly geographically. I don't know the area intimately, but the map appeared to show that that might get interesting in the future.
Yeah, I think in the event of any changes to the location of pharmacy, there are parts of the city that you can see that would create a gap if they were there. And I think the position the board would take is, as it has done in the past, that we would oppose any consolidations that create a gap in that way. Less so around if it's just a change to the hours covered. There's less that we can do around that because we still have some provision across the city. But yeah, I think be assured we'll bring those back to the board as we always do if there are requirements to respond to significant changes like that.
Roger.
Yeah, I'd like to commend the team on producing it. It's fascinating. I'm a bit like Diane. I've read it cover to cover. Not quite bedtime reading, but it's out for consultation. I know Healthwatch is one of the interested parties, so I've consulted on this already with Healthwatch. Lots to say, so looking forward to, I won't go into it in detail, I've got loads of notes, Matt, so I look forward to having a discussion on it.
We're aiming to launch the consultation on 1st of April, or possibly the 2nd, or somewhere around then, and we will notify the statutory partners when that consultation is open as well.
Thank you, everyone, and yeah, my thanks to the team putting this together. It's been really successful. Our last pharmaceutical, also our current pharmaceutical needs assessment, it has helped us, and so myself and Linda have been delegated authority under the current pharmaceutical needs assessment to give the view of the board indeed, as Matt said, opposing some consolidations based on that. So it does give us real power, and if we get one that's really good, we can make sure that our city is well supplied by pharmacies. So look forward to. So we do have a formal thing about adopting this to take to consultation. Is everyone happy with that? Fantastic. Okay, back to Matt again for Health Determinants Research Collaboration update. Thank you. We will try and wrap up as swiftly as possible if anyone else needs to leave soon.
Yeah, I mean, this report's really for information. We've brought reports to you before about the successful bid for the Health Determinants Research Collaboration that we've now officially launched in Portsmouth. So we're one of 30 HDRCs across the country, creating the infrastructure, the capability, the capacity to allow more research around what impacts on health inequalities to take place in the city. I won't say any more about it now, really, just to note that we've moved from the development year into the full HDRC. It's a really exciting collaboration between the University of Portsmouth, Hive Portsmouth, the Council. It will involve all of you. It already is. So the Rethink project that Lucy mentioned and the evaluation work around that is connected into our HDRC, and we're supporting that work. So there's lots going on behind the scenes. We're busy recruiting the team, and we'll be doing some formal kind of comms and some launch work around that once we've got all of that in place later in the year. So I will bring lots back to this board for discussion around that. In the meantime, if you've got any questions about it, catch me outside of the meeting.
Thank you, Matt. And yeah, we had a very quick update about this yesterday at Cabinet, and obviously this is something that covers, again, is another example of working right around the city, all the organisations, and of course really focusing on community members to do their collaboration and their work to steer things in the right direction for all of us. And finally, Bernie, Integrated Care Partnership Joint Committee update.
Hand over to Fran, if you don't mind, please, Councillor Winnington.
Certainly. Over to you, Fran.
Thank you. So I'll keep it brief as well, because this was just for information. But the Integrated Care Partnership, just as a reminder, is a joint statutory committee across the 4 local authorities and the Integrated Care Board. In Hampshire and Isle of Wight, we are far more inclusive, and we have NHS providers, voluntary sector, fire, police, and Health Watch and many other people that I'm sure are mentioned in the report. And we also have an assembly model, which isn't statutory, but is quite unique, actually, across the country, which is where we bring all partners together to amplify, share best practice, and engage and network around key priorities for the Hampshire and Isle of Wight population. The ICP only has one responsibility, one statutory responsibility, and that's to set the health and care strategy for the Hampshire and Isle of Wight system, and that's why it's really important that we come here, because we need to make sure that is supportive and doesn't duplicate the Health and Wellbeing Board strategies for each of our places. And some of the ways that we've done that is obviously Councillor Winnington sits on the joint committee. We work very closely with our directors of public health, and we are starting to bring reports to the Health and Wellbeing Board so that we can make sure that we're continuing to move in the right direction. I won't go into in too much into what's in the report, but I'll sort of put a few kind of amuse-bouches out there so you can go and have a look. One of the things that we did last year was the work around children and young people's engagement, and children and young people have developed some recommendations to the system, which they did a huge amount of work and research into what's really important. And just to reference, there was a particularly impressive piece from a young person in Portsmouth around periods and sexual health, which I know locally is being taken forward. So that was a really key piece of work, and the action plan has just been released. I think it came out yesterday officially, although it's been shared. So we really took time over that action plan to make sure that those actions were landing in the right forums to be driven forward. Another one was the trauma-informed work that's been going on in partnership with the Constabulary and Police and Crime Commissioner. And again, we've seen a real movement. That work was going on already, but through using some of the assembly models, we've seen a real increase in engagement around the trauma-informed agenda. So we've got a series of workshops ongoing at the moment, and we're seeing 200, 300 people attend those workshops online, which is really fantastic. Yeah, and they're brilliant. I would encourage people to join. They're really good. And it's mostly down to the OPCC, in fairness, on that one. And then a couple of things to note. So digital assembly, we've done some work on digital inclusion across the system. The digital assembly is next Monday. And we've done some, it's where we're going to share some of the results of our digital inclusion survey that's been going on, and also some of the work from Portsmouth on the work in libraries and around the NHS app. And then the last thing to note, which is a slight change to what's in the paper, we had planned a workforce assembly on the 19th of March. We've made the decision to postpone that, and the reason for that is through planning the agenda. When we're planning assemblies, we're bringing a lot of people together, and we want to make sure that they have a real impact. And we felt we needed a bit more time to engage with our economic development leads around the agenda, to really make the event meaningful, to ensure that whatever comes from that can be actioned and taken forward. So we're pausing, we're working closely with economic development leads across all 4 local authorities to think through what has the ICP come up with, how does it align with some of the work already going on, and what can we usefully do at scale to support that work. And that's all I was going to say.
Thank you very much, Fran. Any comments or questions? Helen? And then Roger.
I really thank you, Fran. I think it's good because this is the first time I think we've got a formal report, and I know we are going forward. And I just want to make the point, because I think we forget this. When Fran says we, she's talking about we. I know it's really obvious, but I think we forget that, because I do think there's sometimes some partners not necessarily recognising themselves in this. So I think it's really important, because the work for me, what's really critical is the work, and you can take it either way, but I'm going to take it from bottom up. The work we do as partners in Health and Care Portsmouth, which is very much part of the Health and Wellbeing Board here, then goes up into the work of the ICP. And actually the people delivering the ICP priorities, and we ensured that they were very similar, so we ensured from each of the places that our priorities that we have locally, so that's the health and wellbeing strategy, it's our Health and Care Portsmouth priorities, feed into the ICP priorities. I know I'm stating the obvious, but I think it's really important to say, so we own it, all of us,
And I think we've got to make sure, which I think this is why it's really helpful, that the work of this board is seen as connecting very strongly into the ICP. So I'm stating the obvious, but I think it needs to be repeated and said. And thank you, Fran.
I agree with Helen, but I'm intrigued. I'm still after a chart of who works where in the ICP, ICB. I've been promised it for ages. People keep saying it's ongoing. So just a plea to know who sits in what role.
I think the chart is almost ready for the ICB. I think the ICP is quite easy because, as Helen says, it's not really an organisation, it's people around this room. But I can definitely share that. Yeah.
Thank you, Fran. And yeah, just obviously as someone who sits on the joint committee, so our next one I think is in May. Hopefully in person this time, as we had to have it online last time. But it is a really, again, it is one of the things about, if you want about the influence of Portsmouth, what we have on our Health and Wellbeing Board has really informed what we have on the Joint Committee in terms of its inclusivity. And that was one of the things from the beginning. And talking to my colleagues from the other upper tier authorities from around Hampshire and the Isle of Wight, they look enviously upon what we have in terms of our inclusivity in our Health and Wellbeing Board. And that is very much what we want to bring into things like the ICP, etc., and keep working with that. And that assembly approach is also a way that we expand that even more. So thanks so much, Fran, for being here and giving that report. Looking forward to plenty more of those in the future. And also, just to reiterate, myself and anyone else from Portsmouth, we are the voice of you on the Integrated Care Partnership Joint Committee, and we do that all the time. So it is very much that two-way process, and it's the way we sort of feed into each other. So that concludes the meeting. Thank you so much for everyone for bearing with us. I know it's been a packed agenda. I hope it's been really, really informative and interesting. And the next meeting is on the 25th of June at 10 o'clock. Thank you very much.